Okay, everybody. Thank you to our panelists and our Elevate ambassadors for the work that they do in their communities. Our next session will focus on navigating survivorship with integrative oncology. It is an honor to have the team from the After Cancer here. They are a tech-enabled cancer survivorship clinic with a mission to provide survivors with knowledge, community, personalized care to support them through the lifelong journey beyond cancer. Thank you for joining us today, and I'll pass it along.
Thank you, Veronica. Can everyone see my slides? Fantastic. First of all, I just want to say to you ambassadors, you're doing fantastic work. I don't think you realize how many lives you're probably touching, but keep up the good job. So thanks for having us today. I am a family physician who's also fellowship trained in integrative medicine, but probably my better qualification is I'm also a cancer survivor. So, nobody knows what it's like to hear those words unless you've heard those words. I've been through the surgery, the chemo, the radiation, hormone therapy, all of it. If you know somebody who's complaining about turning 40, feel free to share the picture there on the left, which is myself for my 40th birthday. The picture on the right is how I chose to celebrate my 15-year survivor mark. I called it my bald to buff journey. But as so many of us know as cancer survivors, when you first hear that word cancer, it's like getting thrown into a hurricane. Things happen fast, it's scary, you feel like you have no control. And that's where I think we need to really step in. Someone mentioned it earlier. That's when we need to step in and help these folks. So I look at the stages of a cancer diagnosis as diagnosis and workup. There's the treatment, there's the recovery, there's the risk reduction. What are we doing at the end of treatment to decrease the risk of going through it again? And then there's long-term survivorship. And I think, as was also mentioned earlier, when should survivorship care start? I think traditionally we've started survivorship at the end of active treatment, but I think it needs to be started at the time of diagnosis so we can hopefully get in there and lessen or prevent cancer-related effects and start these supportive services earlier. I see it as 7 key components of that survivorship care. There's the support through treatment. There's the assist in the recovery from treatment. We need to monitor for late effects. We need to monitor for disease recurrence. We need to have a surveillance system for new medical conditions that might be as a result of the treatment. Once again, we have to have that risk reduction. And as Lou has said very many times this morning, support for that patient and the family. And survivorship's changed. For many individuals, cancer is now a chronic disease. There's not going to be an end of treatment. They're going to be on treatment for the rest of their life. We've made so many advances in stage 4 cancer. So this is another way we need to go in and kind of change our view of survivorship. Now, if many of you have seen this slide before, it's often labeled as when you feel like, your ass is overwhelmed or overworked. And I think, our primary care physicians have tremendous burden of care right now, the things they're having to deal with in the office and take care of. Our oncologists are becoming overwhelmed. So there's this opening and this kind of niche that we need to fill to take care of some of the survivorship care and help come alongside the oncologist. I tell my oncologist, you treat the cancer, I'll help with everything else. And even going in and educating some of our primary care docs on the needs of cancer survivors. This is an article that just came out August 2024 in Nature Reviews Cancer that talks about integrative medicine in oncology, redefining the standard of care. And it says, integrative medicine incorporated alongside of cancer care, referred to as integrative oncology, is an evidence-informed field with established clinical guidelines. Although integrative oncology improves patient outcomes, it is inconsistently provided to patients. To align with best practices, it is necessary to increase awareness of integrative oncology, improve access to treatments, and provide consistent financial health care coverage for this. So I think this is what can fill that gap and help us with those survivorship needs. So when you have integrative oncology, you're going to look at the physical, the psychological, the social, and spiritual aspects of that patient. You're going to try to optimize healing process, hope to minimize side effects of treatment, hope to maximize recovery, hope to decrease the risk of recurrence, enhance that patient's sense of control, that they feel like things are going on around them or being done to them, and then incorporate complementary therapies. These are the complementary therapies. There's the mind-body techniques that might include a meditation, guided imagery, some of our music, art, or dance therapy. There's body-based therapies, which could be massage therapy or exercise, which has been mentioned several times this morning. There are the energy therapies, healing touch, qigong, tai chi. There's the biologically based therapies, herbal remedies, vitamins, other dietary supplements. Then there's the ancient medical system, the traditional Chinese medicine, which could be an acupuncture or even Ayurvedic type therapies. But I think it's most important to say what integrative oncology is not. We are not crystals. We're not magnets. We're not new age medicine. We're not coffee enemas, chelation therapy. We are not alternative medicine. And this has really grown. It's become more important because some studies have shown that anywhere from 60 to 90% of patients are using something and they're not telling their oncologist. They might fear of being dismissed. Once again, that sense of disempowerment, or they don't feel supported by their provider. And, the most common thing that people are using are supplements. And that's where we have to be cautious. I tell patients all the time, I don't want you taking something that can make your therapy more toxic or less effective. So this is going on, and we need to have a safe place to give good information about what our patients want to do or why they want to do it. Because they're getting bombarded with this. I mean, this is all over the internet. Either the patient seeing it or a family member sees it and tries to get their loved ones to do it. I mean, I think even right now there's a Ellie McPherson or somebody that's on the internet right now who's talking about how she used alternative treatment for her breast cancer. And there's a lot of misinformation and questions. So this is something that we've got to have good answers for patients and be able to say what's got evidence and what does not. In fact, this was a study that came out in 2018 from the National Cancer Institute. It's called The Use of Alternative Medicine for Cancer and Its Impact on Survival. And in this study, they took patients with non-metastatic breast, lung, and colorectal cancer. And the patients who said, hey, I'm going to go do this alternative therapy first. If it doesn't work, then I'll come back to conventional care. Those patients were 5 times more likely to die from their disease if they chose to do that. So our challenge when we bring integrative oncology on board is, what can we do to decrease that risk of progression? What can we do to decrease the risk of recurrence? How can we support the efficacy of conventional treatment? Can we improve tolerance of conventional treatment? Typically, this might be like a chemotherapy-induced neuropathy. If we can do something to improve the tolerance, then that patient might be able to get their full course of treatment and not have to have dose reduction or have the treatment stopped. How can we maintain quality of life? And how can we prevent complications? So integrative cancer care would have benefits during active treatment and for the end of treatment survivorship. It would have strategies for reducing the risk of cancer recurrence. It would have key concepts and concerns in the use of dietary supplements. It would have the promotion of healthy habits, including nutrition, physical activity, and stress management. The benefits would be a whole person care and to incorporate evidence-informed use of complementary modalities in the side effect management. These are the top issues that I typically see patients for, that support through chemo, help with fatigue, help with neuropathy, help with arthralgias or joint pain, insomnia. I haven't met a survivor yet that didn't have trouble sleeping. Questions about herbs and supplements, recurrence risk factors, issues of anxiety and depression, that fear of recurrence, and sexual dysfunction. So there's the Society for Integrative Oncology, which is an international organization. And the mission is to advance evidence-based, comprehensive, integrative healthcare to improve the lives of people affected by cancer. And one of their goals is to develop evidence-based guidelines for incorporating complementary and integrative therapies into conventional oncology practice, because that's really what it is. We want evidence-informed strategies. We want to know that what we're doing has been researched to help. And in partnership, the SIO has worked with ASCO, which is the large organization of clinical oncologists, to develop these guidelines based on evidence. I don't know if you can see these, but if you look through this, the most recent one was on fatigue. They've done one on cannabis and cannabinoids. They have one on anxiety and depression. They have one on pain. They have one of integrative therapies during breast cancer treatment. They have one on lung cancer. So these have looked at all the evidence, and here's what's available and here's what we know about it. This is an example of the guideline on pain. So this is for patients with cancer experiencing pain. In the middle column, you'll see aromatase inhibitor-related joint pain, which is something our breast cancer patients deal with. To the right, acupuncture and yoga have been shown to help. Third one down, chemotherapy-induced peripheral neuropathy. Once again, acupuncture can help. So this is the way the guidelines are set up, that it shows you what the condition is and what evidence there is for those integrative strategies. And also, when we're taking care of cancer patients, we want to follow the NCCN guidelines. So this is the 2024 guideline on fatigue. And if you look under the other interventions, there are multiple things that are in the integrative or complementary therapies. So it's in the guidelines, or these are things that need to be provided for that symptom. But once again, as I mentioned earlier, many times integrative is not available at a lot of cancer centers. This is the survivorship guideline for hormone-related symptoms in females. If you look down at the left bottom, integrative strategies is recommended. I can't tell you how many times I've recommended acupuncture for hot flashes. And then not to leave our male patients out for this is hormonal symptoms in male survivors. Many times this is a prostate cancer patient. And once again, integrative therapies is listed. We've used lots of acupuncture for those guys that are having hot flashes. This is the guideline on anxiety, depression, trauma, and distress. Once again, down at the bottom, it says consider referral for integrative therapies. So these are in the guidelines. The challenge is to get these therapies and services to patients. So an integrative oncology survivorship clinic would take care of newly diagnosed patients during treatment side effect management anytime during that continuum, help at the end of treatment recovery, help with cancer recurrence risk, and then taking care of long-term survivors. So if I saw a patient who was just diagnosed and was just getting ready to start chemotherapy treatment, this would be what my plan would look like. I'm very conservative and actually would probably look at avoiding most supplements during chemotherapy because we just don't have good evidence on the supplements. I might base that on lab work. We'd look at the gut health. Would a probiotic be beneficial? We would deal with sleep issues. We would get some mind-body programs involved with just the stress and anxiety that goes along with it. We'd have acupuncture. We'd look at physical activity. There's more and more research about the more muscle mass we have, the better off that survivor is going to do. We'd look at nutrition, and we'd probably get a vitamin D level checked if it had not been done before. It's been mentioned earlier by one of your ambassadors, sexual dysfunction. This is not addressed. It's not asked. And it's something that needs to be a routine part of our care is to ask, but we also need to have services available to help with the dysfunction when it's there. So that's kind of talked about up to the end of treatment. And, I tell patients sometimes the end of treatment's worse or harder than the diagnosis. And you're thinking, I didn't know I had this. Is it going to come back? Will I know if it comes back? Now I have these side effects, and can I do anything to keep it from coming back? So end of treatment is a tough transition. So the essential components of post-treatment survivorship care would include that surveillance and early detection of new cancers, the promotion of healthy behaviors, risk reduction for recurrence, and then interventions for the consequences of cancer and its treatment. And this coping with the fear of cancer recurrence, it's real. Those of us who are survivors and work in a cancer center, we have to deal with that ourselves, not to let what we're seeing happen to somebody stoke our own fear. There's the whole concept of survivorship guilt that's out there, but this is something that needs to be addressed for every cancer survivor. And like I said, we know it's prevalent in cancer survivors. Some studies show it ranges from 5 to 89%. I'd say it's probably higher. It's described as the largest concern of breast cancer patients. Other studies showed that it persisted up to 9 years. I'd say it lasts much longer than that. This is an interesting study that looked at the cause of death for breast cancer survivors who did not die of their cancer. What they died was from conditions that were modifiable through lifestyle changes, diabetes, heart disease, or not having a cancer screening and died of a second cancer. So this is an opportunity at the end of treatment to get in there and decrease that risk. Now, I tell my patients, I want them to become stronger for what they've been through. So prevention and recurrence of new cancers, looking at tobacco, alcohol usage, looking at body weight, looking at, are they exercise? Are they active? What's their nutrition like? How do they handle stress? What are their risk factors for other cancers? And are they getting cancer screening? I heard an author one time who described the cancer diagnosis as like got mold in a basement. So often you go in and you cut out the mold. You might put chemicals on the basement. You might radiate the basement. But if you don't change the basement, the cancer is more likely to come back. So all this is putting together a basement plan for our patients to deal with those risk factors. So at the after cancer, if you had asked me before the pandemic, can I do what I do virtually? I would have said, no, I have to be in a room with the patient. I have to see the patient. I have to be able to hug the patient. But after going through the pandemic, I've realized that, we can do this virtually, and we can make a difference where these services are not available. So we'll kind of open it to questions. I think Mariana is on board if she has some other input too.
No, thank you so much, Chase. I always love hearing you talk about integrative oncology and how to apply it on the different phases of treatment and after treatment. And our goal really is to combine all of this expertise and all of this evidence-based information that it's out there and make it accessible by using technology. And so that's really our intent within the after cancer. So I think we can open for questions. Thank you.
Okay, so I can pop on. If anybody in our audience would like to ask our guests some questions, you can put them in the chat. But I'll start off. We can have a little conversation here. So how should survivors start? What is your advice for starting the process of finding integrative oncology in their life? What should they do, and what's your advice for them?
So I always think the Society of Integrative Oncology is a great source. I know Betsy's on this call too, if she wants to add some more information about that. That's a great source to go to. It's an international organization made up of folks who do integrative oncology. And like I said, that's part of our thing is we want to bring together folks to use this evidence to help patients no matter where they are.
And I know we're starting to get some questions about how to connect. So everyone, the slides and information is on our events page that you can connect to these two wonderful individuals to get the support that you need. Do you offer what do you offer at the After Cancer, and what does that look like?
Mariana, take it away.
Sure. So we have a portal where we offer access to experts in survivorship care. So we have a multidisciplinary team from physicians like Dr. Bailey-Dorton, but also nutritionists, therapists, PTs, and other different practices. But we've also created like a mini survivorship clinic on your phone. So there's group sessions that are free of charge that you can attend. So everything is evidence-based. We have, I think, Qigong in 2 weeks that is free to join online. There's a lot of education content. So we try to digest all of these papers from ASCO and SIO, et cetera, and try to make it digestible to patients. So better understanding what's out there and how can you learn from your experience. And then we talked about it earlier, community. So we tried also foster community within the patient as we do a lot of group sessions about some of these practices.
Thank you. So another question that came in, and this is for Dr. Bailey-Dorton. How do you suggest that you increase communication amongst oncologists, integrative oncologists, your primary care provider? Is there any tips or tricks to help survivors create more collaboration and care and communication? And do you have any tips on how to do that?
Well, I think it's neat is, this collaboration with the SIO and ASCO is even taking some of these guidelines they're online into your oncologist and say, these are guidelines that your organization has come up with. Was that be available or something that I can take advantage of? I mean, a lot of programs have bits and pieces of survivorship. Sometimes honestly, oncologists might not think about it because they're focused on that active treatment.
So I know you did talk a lot about therapies, the different therapies, but can you talk about I know with collaboration with us, we did some videos around supporting survivors. I know one of the videos was around the side effects of hormone therapies.
Mm-hmm.
And we kind of have a question in the chat regarding supporting that. Like, what are ways to support different plights of survivors that they might have?
Well, I think of hormonal therapies. I think of the breast cancer patients dealing with the hot flashes or the prostate cancer survivors. There's, like I said, good evidence for acupuncture. Most communities do have an acupuncturist in the town, is reaching out to that person and say, do you have experience treating these symptoms in a cancer patient? If so, I'd like to come get that. There's a lot of evidence out there about nutrition, how that can help our bodies. There's a lot of, one of your ambassadors is working on an exercise program. There's tons of research about how valuable exercise is for our survivors and dealing with some of these side effects. I think some of the work that you're doing is fantastic because you are getting the word out about what's available to help with these side effects.
So I know, and in the past, we've talked a lot about, and you highlighted it well, about the difference between complementary therapies and alternative therapies. And the point, and can you emphasize or talk a little bit more why it's so important to tell because they are piecemeal, you might not be participating in things in your cancer center, and why it's important to share with your healthcare team what you're doing in the community?
Well, I think the biggest thing is there's so many things, specifically supplements, that this is not feasible to do research on every supplement or herb that's out there. And we don't want to do something that's going to, like I said, make that treatment more toxic or make it less effective. And there's so many newer treatments, like some of the immunotherapy out there. We're not sure how some of these interact. So, like I said, during active treatment, I think it's best to be conservative to avoid most of that. Once we get to that survivorship or the end of treatment period, I think there's a little bit wider window that we can use some of those things. Because I think it really boils down to the point that survivor wants to do something to help themselves. I went through what can I do to help myself get through this, decrease the side effects, decrease the chance of it coming back. So if we can enable some of these safe therapies for the patient do it, they get that great sense of empowerment back again, taking charge of their health.
Do you, so we have a question. Can you talk a little bit more for those not familiar with acupuncture? You've mentioned it a couple of times, how beneficial it is. Can you just give a nice little overview of what that means? And should they, before participating, again, should they make a request, should they be directed from their oncologist, or how do people safe way to engage in acupuncture?
So a couple of things. First of all, when I used to mention acupuncture to a patient, they're like, oh no, not more needles. But acupuncture is different. The needle is as thin as a hair. It does not hurt. There are good indications. I use it the most for neuropathy, hot flashes, and joint pain. But there are precautions that need to be taken. If somebody's white count's really low, an higher risk of infection, you don't want them to have acupuncture at that time. If somebody is on a blood thinner and their counts are low, you don't want them to get acupuncture. It's the same thing for like massage therapists. You want to go to somebody who's trained in oncology massage so they know how to deal with the port. They know how to deal with maybe a metastatic lesions. So you want somebody that's trained in that for specifically for cancer patients.
Perfect. Thank you so much. And can you talk about tech, since you're in a tech-based platform, where do you see technology going, and what do you hope and dream that technology, what's the overall goal for the after cancer, and what do you hope it's going to look like in the future as it
Awesome.
continues to grow?
Thank you for that question, Veronica. I think technology enables us to do two things. One is grow access. So I saw a couple of folks mentioning on the chat how they live in rural areas and they're far away from their cancer center. A lot of like community hospitals also don't have these type of services. And so technology is really an enabler to give people access to services that they did not have access before. And a plus I would say is that you can do some of these things from the comfort of your own house. You don't have to drive or like spend time in your car or taking public transportation to go to a hospital, to go to a center where you can have access to these services. I think the second thing is really like learning from what patients are doing on our platform, learning how they are reacting, so we can understand are you feeling better because you've done exercise or because you follow the protocol by Dr. Bailey-Dorton. So having that almost like immediate feedback loop from patients while they are in their house, so they don't have to always have a visit every week to tell Dr. Bailey-Dorton how they're feeling. They can maybe just chat and say like, I'm feeling better, or you told me about this. How can I do it? I'm not sure. So it's really having that feedback loop is really important because we can, at the end of the day, improve patient outcomes and improve results.
So on that note, I want to thank you for joining us, and the resources that you shared will be on our website. So we are going to take a 5-minute break, and then our keynote will start shortly. We hope you will all join us again back in 5 minutes. Thank you both.